Aloha from the East-West Center in Honolulu. I'm Susan Kreifels and I'm the manager of media programs. I want to thank all of our viewers from around the world for tuning in today for this very, very important program on COVID responses in the United States and Asia, lessons learned and best ways forward to defeat this pandemic. The East-West Center is very honored to have two distinguished public health and infectious disease experts speaking today. Dr. Michael Osterholm from the University of Minnesota was a speaker at our very first International Media Conference in Bangkok in 2008, and we are so pleased that he is joining us again today. Thank you. Dr. Keiji Fukuda is from the University of Hong Kong, which was an EWC partner for a series of health journalism reporting tours after the SARS pandemic. So we're very happy to have Dr. Fukuda with us as well. Thank you. Because we have such distinguished speakers, I want to move on quickly to share our webinar protocols and then introduce our moderator. So today's webinar is on the record, recorded on Zoom, and will be made available on YouTube for later viewing and sharing. Your microphones and videos are turned off according to Zoom protocols. Each speaker will comment for 10 to 15 minutes, and Q&A will start about 50 minutes into the program. To ask a question, write it in the Q&A tab in the bar at the bottom of your Zoom screen. Please specify if there's a particular speaker you want to address your question. Join the conversation on Twitter, hashtag EWC Seminars Live, and Instagram at EWC Seminars. Join our website, check our website for all of our webinar information, full speaker bios, and YouTube links at www.eastwestcenter.org/EWC Seminars Live. And from that website, you can also easily access information to our media programs. We are very proud of the more than 4,000 journalist alumni that we have around the world. I would now like to introduce our moderator. Maren McKenna is an independent journalist who specializes in public health, global health, and food policy, and is a senior fellow at the Center for the Study of Human Health at Emory University in the state of Georgia. She is an acclaimed author whose 2017 bestseller, Big Chicken, The Incredible Story of How Antibiotics Created Modern Agriculture and Changed the Way the World Eats. She received the 2018 Science and Society Award and was named a Best Book of 2017 by Amazon, Smithsonian, Science News, and others. We are very proud that she is also an alumnus of EWC Media Programs who participated in our first post-SARS health reporting tour. So now I'm going to hand it over to Maren, our moderator. Thanks so much, Maren, for taking over. Thank you.
Thank you, Susan, so much for that kind introduction. And good evening and good morning to all of you who are joining us around the world for this extraordinary opportunity to hear from two of the top experts in the world on this extraordinary moment that we find ourselves in more than 6 months into a global pandemic that is unlike anything we have experienced as societies in more than 100 years. I'm very, very pleased to be joining Dr. Michael Osterholm and Dr. Keiji Fukuda, two academics and experts for whom I have enormous respect and who have been fantastic sources for me in the past. And I know that the knowledge that they'll share with you over the next 90 minutes is something that you could not get anywhere else. Their bios are on the site. I won't burn up our precious minutes describing to you all the ways in which they are incredibly distinguished. I'm going to go straight to them. So I'm going to begin with Dr. Osterholm. Mike, if you could describe for this worldwide audience where you think we are in this pandemic, and at this moment when we are more than 6 months into it, what lessons you think we should be looking forward and taking from at this point.
First of all, let me thank you very much, Maren, and thanks to all of you for the opportunity to be here. It's a real pleasure and an honor to be with you and with KJ, who a dear colleague and trusted friend. Let me just say that we're really in uncharted territories, and I say that not because any one pandemic is like another pandemic, but this one isn't like the pandemics we've thought about and planned for, namely those caused by influenza. We're now dealing with the coronavirus pandemic, which we've never experienced before, at least not that we've recognized in human history. And so one of the challenges we have is how will this unfold? In the earliest days, there was a question, would this be like an influenza pandemic where we might have a first wave and a trough and then a second wave, and have it then have some potential for hemisphere differences in terms of when it showed up, where it showed up. And what we're realizing that all of that is out the window. This is acting like a coronavirus, and it's doing what it does very well. It's, to me, what I would consider to be a global forest fire, a major forest fire, and it's burning all the human wood it can find. There's been no evidence of seasonality. There's been no evidence that somehow it's going to slow down and speed up. At the same time, we don't understand why in some areas of the world, it appears to have spared those areas in the first 6 months, but now ravaging them something fierce in terms of transmission. It's a virus that has unfortunately borrowed some of the worst of influenza and SARS and MERS, where we know that transmission occurs primarily early in the infection, and in many cases it may be very mild asymptomatic infection, and that there is clearly a pattern of transmission that's similar to what we see with SARS or MERS, at least in the later days of the transmission, where we may have super spreading events. Remember, super spreading events are a combination of both the individual who's infected as well as the location and the area for which they are transmitting in, primarily indoor air. So where are we going from here? You asked where we're at. I think if I could use, since we have a number of people here coming from countries with great interest in baseball, let me just say we're only in the third inning of the ninth inning, I think, of a 9-inning game. At this point, we are really just beginning to see this unfold. In the United States, for example, we estimate that no more than 7 to 9% of the population has yet been infected. That's a long ways from getting to a 50 to 70% level of infection and hopeful immunity through natural infection anyway, and developing herd immunity. Will we get there with vaccine? We have many questions yet. Is there durable immunity with a coronavirus versus an influenza virus? What does that durable immunity mean? We have to ask ourselves all the clinical questions that are coming up every day is, how is this virus doing this or that? We now recognize that it's a very complicated infectious disease involving many, many different organ systems. And we also have to ask ourselves from a vaccine standpoint, will in fact we get a vaccine with durable immunity? Will it protect those who are at highest risk of having serious disease? And what might be the long-term issues around safety? Will there be immunologic aspects to this disease, much like we see with antibody-dependent enhancement, et cetera, that could be a concern even years down the road from this vaccine's use? All questions that we still have to ask and answer, and we haven't yet. So let me just say, we are really just at the beginning yet. If we get a vaccine and it becomes available in a number of parts of the world through different companies in different countries, we can't expect much impact well before early next year. So for the rest of this year, calendar year, we're going to be living with it, and we will be living with it for a long time after that. This virus is here to stay. The challenge is, how do we learn to live with it? And that's tonight, I'm sure, will be the thrust of a number of questions. So with that, I'll turn it back to you, Maren, and thank you again for having me.
Mike, thank you so much for those comments. I already have so many questions based on what you said, but I'm going to wait to hold those until moderator's privilege, until both of you have spoken, and then I'll get things started. So I'm going to turn from you to Dr. Keiji Fukuda of the University of Hong Kong, a university that is as dear to my heart as the University of Minnesota is, because I have had the opportunity to appear at both. Keiji, I wonder if you could talk to us for a few minutes about what the experience has been on the Pacific Rim. I'm in Atlanta, a couple of miles from the door of the CDC. Mike is in Minnesota, but our perspective on what's going on in this is necessarily going to be very different than it is in Hong Kong, in China, in Southeast Asia. And I would just love to hear your comments about the challenges from your point of view and what has been learned at this point from the very different experiences of the different nations in the area where you are.
Great, thanks, Maren. So I also want to start out by thanking Susan for the invitation and for the East-West Center for hosting this. And just say it's an absolute pleasure to be working with Maren and Mike on this discussion tonight. I think we've known each other since the 1990s. I hate to go back that far, but it's true, and it really is nice to be having this discussion with the both of you. So just to put some perspective on this, I want to actually reach back a little bit and give you some observations about what I think is going on in general, and then bring it back a little bit to your question, Maren, about what's going on in Asia. But you know, when I think back to previous experiences, and this has been dealing with outbreaks ranging from small ones, you know, from institutional outbreaks up to large ones, you know, for example, the 2009 global pandemic, and then thinking about the different parts of the world that I've really had the honor and the pleasure to work in, and this is on the field in places like Africa and different parts of Asia, as well as the US, and places like the Middle East, such as Egypt and Saudi Arabia. It's clear that these perspectives really at least help me to understand COVID a little bit better. So, you know, if we first look at COVID and just say, what is it about this outbreak which stands out? Mike was going over a lot of the critical aspects. When I look at it, some of the things which I'm really struck by is simply what we all see, the absolute sheer level of impact on of this pandemic, and it's from individuals up to global levels, and then even beyond. If we look at the impact on pollution patterns, for example, we can also see that there's a planetary level effect. The second thing which is really remarkable about this event is that it is being managed at the head state level. We've never seen this before. We've seen other outbreaks like SARS or Ebola, in which heads of states have been involved, but not something managed at this level. So when we see countries represented on television, it may be President Xi or President Trump or Chancellor Merkel or President Bolsonaro, but it's a quite remarkable thing. And this is important to note because the way that we think about outbreaks is largely shaped by technical and operational issues. But this heads of state representation tells us that we're really dealing with a crisis. And not all outbreaks are crises. Some outbreaks are simply emergencies, and others are genuine crises. It's to get your heads around this, this is a little bit like someone showing up in an emergency room with a heart attack. It's an emergency, but you can contain it, you know what to do. But as Mike was alluding to, here we're in a completely different ballgame, and it is being managed as a political event, which is important to keep in context. But I think the third thing is that we haven't had an event like this in our lifetime, which is shedding such a light on what works and what does not work, and then really what is working in the world. So in my experience, you know, all outbreaks as a kind of microbiological and ecological phenomenon start somewhat differently. The start of HIV is really different than the start of pandemic influenza in many different respects. But as sociological events, as something happening in societies and in countries, outbreaks are remarkably similar in certain respects. They all start with a level of surprise and confusion. And it's really what happens next which distinguishes successful responses from less successful responses, and comes back to this question of East versus West. And so the key question for us to look at in trying to get a hold of how we're doing is whether a location or country can adapt effectively. And I think it's that adaptation which is the real issue. There are good examples of what I think are adaptation. I think when bird flu first appeared in Hong Kong in 1997, that was an event which completely took the world by surprise, certainly the scientific world, and yet it was rapidly contained. If we look at the emergence of another influenza virus, H7N9 in mainland China back in 2013, it stood in stark contrast to how China handled SARS a decade earlier. and for me was a strong testament of how a country had been able to learn from an earlier experience and then really strengthen its capacities. And so that assessment of that H7N9 emergence showed that, you know, China had really changed a lot. I think another good example of successful adaptation was in 2015. This is when a traveler brought the Middle East respiratory syndrome virus into Seoul. And at that time, again, Korea was really quite shocked to find that it had a large number of nosocomial outbreaks going on. And frankly, the country was embarrassed by it. Internally, there was very severe self-criticism. But again, in going to Korea and seeing how the country was handling the response, it was very clear from that firsthand observation that they're rapidly adapting to the situation and taking existing capacities and adjusting it to the situation. Not all outbreaks turn out that way, of course. I think the SARS is a good example of something that was mixed. Another example of an outbreak which was mixed in terms of its successes was the 2009 H1N1 pandemic. You know, that one started out pretty well. Mexico, Canada, and the US reported very quickly, and they shared information quickly according to the international health regulations, and basically did what countries are supposed to do. Things like initial communications went well, the development of vaccine went well with companies and governments working together quite closely. But then the response did run into problems. One of them was that the pandemic plans at that time proved to be rather inflexible. The cooperation among countries on vaccine sharing was quite difficult. And I think WHO itself stumbled on a number of meeting public expectations. And consequently, later in the pandemic, WHO was accused, for example, of crying wolf and then also of being a front for vaccine companies to sell vaccines. Other outbreaks we've seen have simply been terrible. You know, the 2014 Ebola outbreak is probably the best example of that. But detection, reporting, recognition were all slow. National capacities were very weak. And the cultural norms and the public expectations simply were not well addressed until far into the outbreak. And finally, the support from outer countries was quite strong, but it was also ambivalent, and it was also greatly driven by the idea of wanting to keep that infection out of their countries. And so when I look at those things and I look at COVID, what it comes down to me is three things if we want to see really what works. It's the level of leadership and governance. It's the strength and the adaptability of the existing systems, the ones which are there in place, and it's cultural norms and expectations. So currently with COVID, we have a huge amount of attention on numbers and actions. And of course, these aspects are important, but they're meaningful only if you know the context. And frankly, the numbers themselves are confusing. They're often misleading, and eventually they have become numbing. We have created a kind of paradox where we're swimming in a sea of increasing information, but at the same time, in parallel, we are losing perspective on many aspects of this outbreak. So if we look at Asia, what does it feel like here? I mean, it's clear that some of the countries, and perhaps many of the countries, appear to have done well. And, you know, some of them have been in the news a lot. But if we look at some countries such as Vietnam, which maybe have not had as much attention, it's a very interesting situation. You know, Vietnam has about almost 100 million people. As of yesterday, I believe it had reported 438 cases and no deaths. And so the obvious question is this possible? Is this even real? When you look at what Vietnam has actually done, some things are striking. One of them is, like many of the Asian countries, it experienced SARS directly, and I believe that it's applied lessons from that. So for example, you know, early on it prioritized health over economy, made that clear. It implemented a number of control measures like contact tracing and quarantine aggressively and early. it began testing a lot. I believe that it has tested about 800 people per case, which I believe is the highest ratio of testing in the world. So an immense amount of effort. And then it instituted border controls and social distancing quite vigorously. And then finally, what is striking, like in many Asian countries, there has been a sense of community mindedness in that country. And so when you look at those underlying attributes, you begin to get the sense, no, these numbers could be real, and it certainly does reflect and make sense based on what has been done. Now, because Vietnam is a one-party country, its approaches are not necessarily applicable across the board, but many of the approaches are directly applicable to every country. So for example, the lessons of learning from the past and strengthening infrastructure, setting priorities early and making decisive actions and decisions, and so on. I think these things are applicable to all of the countries we're looking at. But the part I want to focus on last and I'll stop in a moment, is this community mindedness. So, I've been living in Hong Kong now for 3.5 years, but I first came here in 1997 to work with Hong Kong on H5. And then I came in 2003 to work with it on SARS. And now I am living here during this period of COVID. Now, Hong Kong during this period, as most of the listeners will know, has been marked by a great deal of social unrest and tensions. So 2019 was really very heavily affected by those underlying tensions. And so going into COVID, I was not sure how the public was going to respond to this outbreak. So certain aspects of the response to the outbreak have not been surprising to me. In working and advising the government, I have seen that the chief executive herself has been deeply involved on a day-to-day basis with the outbreak, and there is a whole government approach. The incorporation of public health and scientific expertise has been extensive. It's not only driven by that, but it's certainly been incorporated. The government clearly prioritized health over economy in the beginning, and then not unexpectedly, the systems have been proven to be adaptable. But what's been most interesting for me is that there has been a government-public partnership despite the tensions which have run deep in Hong Kong. And I think that you see this when you walk around Hong Kong, when you talk with people. The cooperation is genuinely high on social distancing and masks. I think it comes down to partly because the government and public have learned from SARS. But I do also think that in Asia, there is definitely a different balance between individual and collective priorities and concerns. It's balanced differently than it is in the West. And so I think for me, at the end of the day, that quality really distinguishes the Asian response to the Western response. It's not unique to Asia. There are other countries in the world who are doing well. If I look at Germany, I have seen that Chancellor Merkel has really been able to tap into that kind of balance. I think the United States in the past has been able to tap into that kind of balance. It doesn't have it right now. This is very obvious, but hopefully it will find it again. And so from Asia, the COVID does pose a huge challenge, which is ongoing. In Hong Kong, we're in the midst of an upsurge, but I think that the fundamentals are here in many countries, and I think it's why a lot of the countries are doing relatively better. Thank you.
Thank you both for your comments. Those were so insightful. We have about 20 minutes now in which I'm going to get to ask you questions. And then after that, we will go to the many questions that are already coming from our audience. So let's start with this. Both of you referenced influenza as the challenge that public health around the world has imagined would be coming our way. KG, as you said, you were in Hong Kong for the 1997 outbreak. Mike, you've been involved at the federal level in planning for influenza pandemics here in the United States. KG, you were in flu planning at the WHO as well. Did we make a mistake by focusing so much on flu? Did the degree to which we had immersed ourselves in planning for a potential flu pandemic somehow lead us astray at this moment? Or conversely, was it the best we could do, the only model that we had for what a global epidemic might look like? I'll let either of you jump in.
Kate, you go ahead if you'd like, otherwise.
Okay, Mike, I'll take a stab and you can show me how I'm wrong on this.
No, I'm sure it won't be the case at all.
Maren, no, I don't think focusing on flu has been a fundamental mistake in that we have to pay attention to flu. It still remains a major risk for pandemics. The 1918 pandemic killed an order of magnitude more people than COVID has. And so the risk of that infection is important to keep in mind. But of course, it's not the only pathogen out there. The fundamental mistake, though, that we have made, and we have made a very big mistake, which is to look at preparedness and getting ready as a series of technical actions. You know, we have focused a lot of attention on surveillance. Do we have enough supplies? Of course, all these things are critical. But the fundamental lesson from pandemics is that if we don't pay attention to leadership, if we don't have strong existing systems out there, if we are not able to anticipate how the public perceives things, their expectations, what are the norms, we're not going to deal with any major event. It doesn't matter what the pathogen is. You know, we can adapt to the pathogen. We can figure out whether we use vaccines or this approach or another. This I'm convinced of. But what we have simply not done is paid enough attention to these more fundamental aspects. And it's because they're harder. It's harder to get leadership, good leadership. It's harder to get the funding in place to really build those systems and to convince, in fact, people that these systems are desirable. And for me, that is what I am struck by looking at COVID.
Mike, what do you think?
Yeah, no, I think KG has hit the nail right on the head. I would say that also, in addition, I think that we have lost our sense of creative imagination to imagine what a modern pandemic could look like.
Mm-hmm.
Let me give you an example, and KG's right about whether we have stockpiles or not is one thing. With or without leadership is what's really critical. But in the United States, we had prepared for an influenza pandemic, looking at our stockpiles to help with our medical supplies, et cetera. We had 25 million N95 respirators in that stockpile, for which they were actually outdated, already having problems with straps and so forth. That had been through 4 presidential administrations, that was all we had. To give you an idea of consumption, we had one hospital in New York in just the first month go through 2 million N95 respirators in that one hospital. And so we all recognized that we needed 350 to 400 million respirators. Why do we only have 25 million just as a stockpile? Because we didn't really think it was going to happen. You know, I think particularly in the United States, at least, and I'll speak for that only right now, we had this belief that we had this invisible wall around us. You know, we didn't get hit by Ebola. Zika never really came. You know, influenzas never really materialized. And if we just go through the laundry list, you know, we basically felt somewhat immune to these conditions. And so, you know, if you look back on all the tabletop exercises that were done, they were really more almost social club events than they were real live fire efforts to know what to do and could be done. So when you got done at the end of the day, oh, we didn't, you know, if this was too hard of a question, we just skipped it, went on to the next one. And I think now that's all coming back. We're now realizing, and just as KG said, leadership is really critical in all of this. I think the second thing that we didn't understand, which has surely impacted a number of countries, is how much we've changed in 20 years. During SARS, no one was concerned about Chinese supply chains and what that meant for the world or for Indian supply chains. And the world's changed a lot. You know, I wrote a piece in 2005 in Foreign Affairs on lack of preparedness. And I just was asked to write the cover article for the July issue of this one. And I took the last paragraph of my 2005 paper and put it as my first paragraph of this paper, and it fit perfect. I mean, it was like I could have written it for that. Just showing how over the course of 15 years, we just didn't get it, and we didn't really get prepared. We didn't really have the infrastructure in place to make decisions, how to handle things. Our healthcare systems, in many cases around the world, are actually less capable today than before. Right now, just as an example, we in the United States have been looking closely at drug shortages, critical life-saving drug shortages. We've identified 156 drugs that people need every day or they die. It's on the crash cart, what's in the emergency room. All of those are generic, all 156. Most of them are coming from Asia. And it's all just-in-time delivery. We had shortage of 62 of those drugs before we ever had COVID hit. Right now, with India on fire, as much as it is, we're now seeing major challenges with certain antibiotics. 85% of all the antibiotics being used in the intensive care units for COVID patients, for secondary bacterial infections, pneumonias, are all drugs coming from India, and we can't get them right now. So again, we never thought about those kinds of things. We never understood global economy and what a pandemic would do because it was different. So I think this one hopefully will take the blinders off and realize we are in all this together. And I think KG said it very well. The next pandemic, if it were like 1918, could be much worse than we're seeing right now. Could be much worse.
Well, I think we should jump on that right away because, you know, a thing that I have heard in talking to both of you before tonight is that we should not make the mistake of thinking that because we are in the 100-year flood now, that this is the only one we get for the next 100 years. The next pandemic, which could be an influenza pandemic, it could arrive tomorrow. It could arrive next year. It could arrive in 5 years. It could arrive when we are still well within the recovery from what we're enduring right now. So what would the two of you say about, even as we're in the midst of this, what can we be doing to shore up defenses for the potential next? Do you want me to call on you? Is it too hard to jump on each other? KG,
No,
you go first.
We can jump.
Okay.
No,
Yeah.
I mean, I think that a couple things come to mind, Maren. The first thing, again, is to simply ask, why is this one so severe? And I think the answer, again, is not, you know, we should focus on pathogens to a certain extent. You know, there is a difference in the ability of different viruses to transmit and to kill. And I think that it is entirely likely that we will see future viruses which are more transmissible and which can kill more people than COVID, as bad as COVID seems. And so those things are clear. But I think the part of the reason is that we are going through a profound impact right now because of the context. As Mike said, the world has changed a lot over the past 20, 30 years. And one of the background drumbeats is the fact that globalization is an inexorable direction that we are moving in. You know, we are in a period in which multilateral relations are really being questioned. Multilateral organizations like the UN and WHO are being challenged, as we know, by certain countries and things like that. But the fact that the world is moving closer together and being more linked through communications, through economies, through technologies, through norms, this is inexorable. And it is also that pattern which gives us some strength, which creates our vulnerabilities right now. So something happens in one country and it directly reverberates in every other country. If China takes a certain way and imposes draconian approaches, which is possible in that country, every other country is forced to either match that or not match it, but it has to make a conscious decision about that. And for me, it's that context, which is what we need to look at and so on, because in some ways, we can be ready for pathogens, but in many other ways, we can really take a look at that inexorable globalization, and those are the things that we can work on consciously without an outbreak or with an outbreak. It's something that we ought to be working on now.
Mike, what do you think?
Yeah, well, I think that, again, history, when we look back on this time period, will probably not be that kind to us in many ways. I think that there clearly has been, as KG's pointed out, some incredible leadership around this issue, and there's been some really deplorable leadership, and you can account for wherever it might be. But I think that the challenge we have right now is that we should be working as a world to deal with this issue. I worry about the vaccines and the competition between Russia, China, the United States, what the World Health Organization is doing, and where our position is right now with WHO. I worry about the fact that while we've always had countries concerned about diseases and economic impact, and flu is always right at the top of that list. We saw that in Africa with Ebola and the challenges of nearby countries being ostracized, etc. But I've never heard anybody talk about the China virus before in a way that was intentionally meant to be hurtful and to basically lay out a challenge of us versus them. And I only say that because I think that one of the things that I am concerned about is the United States, and I'm in the United States right now, obviously, so I may be accused of having blinders on, but when a crisis happened in the past of public health importance, we were always there. It wasn't necessarily that we had to be the leader. WHO obviously had its role, but the United States could be counted on to be a global leader to help all countries. And we always did it in a way that whether it was in our benefit or not. I worry that this new change in position, which surely could, end in a few months if the election changes, but that if we don't do that, we still need a global force to help bring countries together, not farther apart when we have these kinds of events. And I really worry a lot about that in terms of what the post-COVID world will look like. Will it be almost like, in some ways, from a public health perspective, at least, what was post-World War II like? How will we come out of this, and what will public health look like as it relates to these issues in the next 12 to 16 months?
So several people have asked about the role of the WHO, and we are going to get to that. So I want to let the audience know that I am not going to skip over that. But because you both referenced planning for a vaccine, and KG, you specifically mentioned the potential threat of nationalization of a vaccine in the 2009 flu pandemic, when I believe it was Australia and Canada both housed vaccine manufacturers and kind of slid for a while on their previously stated obligations to the WHO to deliver vaccine, and delayed their shipments until their own citizens were taken care of. So among the challenges for a vaccine now, of course, is which one are we going to have? Is it going to work? How are we going to know that it works? What are our correlates of immunity? But also there's the question of how is the world going to share a vaccine or vaccines if as we hope, they are achieved. And I would love to hear comments from both of you about what you see as the biggest hurdles going forward, both scientifically and sort of socially or politically, for achieving, for bringing a vaccine into the mix of combating this. And Mike, I think you are the last to speak, so I'll start with you.
Okay, thank you. Well, first of all, we have to have a realistic expectation that even if we have multiple countries with companies that are able to achieve a vaccine that on a universal basis is seen to be safe and effective, it's going to take a long time to vaccinate 8 billion people. And then remember, most of these vaccines are like going to be a 2-dose vaccine. So just because you have 300 million doses doesn't mean you can vaccinate 300 million people. The next thing that I think is going to be a huge challenge is how will that get laid out? I mean, I can tell you right here in this country, we're going through a challenge right now of determining who should get the vaccine first. And we all know that a vaccine is just that. It's nothing until it's a vaccination in somebody's arm. And, I can make the case, I think, very strongly that the first people up should be healthcare workers who are putting their lives on the line every day. Yet, if you listen to the public already, they're crying out when they hear that, oh, you're just taking care of your own. And so I think the challenges of how that vaccine will be rolled out, who will get it first, is going to be a challenge. Now, having said that, let me contradict myself. Maybe nobody's going to want this vaccine, and I'm exaggerating that point intentionally. We're hearing of ever-growing number of people who say, well, it's not safe, I'm not going to take that vaccine. I think that'll be different in many parts of the world. But I think there's going to be parts of Europe and the United States where we may have a hard time getting people vaccinated. And so that's going to be the challenge. The last thing I just want to throw out there, and this one I always hesitate to do, but since this is such an august, wise group, I know that they can handle it and educate me on it. I still worry about the durability of these vaccines. And, I'm not so sure that we're going to not find ourselves in an influenza vaccine model at some point, where we're going to have to give vaccine, once a year or more. And that's going to create a whole new challenge in terms of this. Right now, we went into this with the idea of one dose, one shot, one time. And I think that we're going to have a subtle reality hit us in the near term that says it's not going to be that simple. And then the world will really have to ask itself some hard questions. What are we prepared to do for low, middle income, high income countries on an ongoing basis? Should that be the challenge?
Katie, from your side of the world, what do the vaccine challenges look like?
Maren, I think that Mike has laid out a lot of the challenges. What I see is that, if we go back to the adoption of the international health regulations, this was really probably the clearest aspiration on the part of countries to have a collective global defense against things like outbreaks, against issues like COVID. And that multilateral mechanism has worked to a certain extent. But in 2009, one of the places where it really ran into difficulties was with vaccine distribution, because the concrete issue was, if you have something which is highly wanted by many countries and it's in short supply, what are you going to do? Very much the situation that we will be in for some part of the COVID situation. Eventually there will be supplies of vaccine which are big enough and that question will disappear. But at the beginning, that question is very much there. And another thing is that we have seen, it is very clear that we are in an era in which big politics is dominating the response in many respects to COVID. And so we are seeing countries acting in a much more isolated way. We do not hear any mention or very little mention of the international health regulations. It's as if that had completely disappeared. And we can see that vaccine is being described as a competitive race, and it's not just in the development of it, but it is clearly going to be in who gets it first. And so right now, similar to 2009, a number of countries are scrambling to sign agreements with different manufacturers to ensure that they get their own vaccine. Even though Gavi and WHO have created a mechanism to try to ensure that there is some sharing of it, it is still going to be very difficult. And I don't see an easy solution to it, to be blunt. I think that it will be important for bodies such as the United Nations and also bodies such as the World Health Assembly to collectively voice their expectations on the sharing and distribution of these kinds of resources, because there are simply countries, poorer countries, smaller countries, which are just going to be locked out unless there is a kind of truly dedicated political commitment to that and a commitment made in public. So I think that we can address the technical challenges, reasonably well. As Mike pointed out, we're not quite sure how durable the vaccines will be in terms of immune response and so on, but I think those are the lesser concerns, frankly. I think it's, are we going to be able to politically muster up the approach where we do have a multilateral approach to the distribution of vaccines And then within countries, I don't know how many countries right now are having an internal discussion. Certainly in a place like Hong Kong, there are discussions going on about who should get vaccine first. But the answering of that question goes back to what are public expectations? Can a government work with the public in terms of making sure that the public government expectations are somehow consistent with each other? That's a really tough challenge for many places. And I'm not sure we're going to meet it in a lot of countries.
So both of you referenced the WHOs, and I promised I would not skip over that for long. So let us go then to the role of transnational organizations. One, and I'm switching here to some of the questions that have been asked by all our listeners. There have been challenges voiced in the United States, certainly, but also in other places in the world to the role the WHO has played in this past 7 months. And of course, the Trump administration in the United States has declared that it is going to withdraw the United States from the WHO. So I would be very interested to hear comments from both of you about the role that the WHO has been playing, how you think it did to this point, too strong, too weak, too absent. Were they tough enough on China in the early days? Are they being tough enough on the United States now? And whatever you think of the WHO roles to this point, where does it draw its power or influence now in order to create some of these crucial relationships and arrangements that you're talking about that have to be created for the world to move forward? KG, do you want to start?
I was hoping Mike would jump on this first. Yeah, no,
You can trade if you want. It's okay with me.
Oh, he's a world expert on this. He knows WHO. Go for it.
Well, okay, so a couple of things, just in terms of the overall perspective. It's really important for everyone to understand that WHO is not a supranational agency which floats above countries like a spaceship. It is really very much more truly a secretariat. It is deeply involved and connected with virtually all countries in the world. And it's a fundamental distinction which is very important to understand, because frequently WHO is criticized for not pushing countries enough or not being independent enough. But in fact, it is not independent. It is very closely linked to all countries, which is partly the source of its slowness at times, but also greatly its source of strength, and why countries come to rely upon that agency and frankly trust them a lot. And the other thing which is important to realize is that WHO does have both a normative role, which it plays when it's not in emergency periods, and it's involved with many, many different programs like polio eradication and nutrition and so on. But during emergencies, it does have a peculiar and specific and unique role in the world. And part of that is to provide leadership. Part of it is to set the tone for the world. Part of it is to provide support to affected countries. Part of it is to provide information. Part of it is to coordinate technical activities. And it should do all of those things. These are what is expected. And it is also the steward for the international health regulations. And so things such as the Emergency Committee, which is what advises the Director General on declarations such as a public health emergency of international concern, are specifically the responsibility of WHO. WHO has been criticized, again, for being too close to China. This is coming from the United States specifically, and the US has been quite aggressive about this. I recently wrote an editorial on this, and I think that this is extremely short-sighted on the part of the US, and it's also in many ways misleading. I think that the role of WHO is to provide support to every affected country. So if you go back to any outbreak that you can think of, Ebola, H7N9, H5N1, MERS, Zika virus, and so on, one of the things which the WHO does is try to provide support. This is material support, this is convening expertise from around the world, and it is giving public support. In this instance, I think that the WHO has been accused of giving China too much public support and being seen as overly biased towards there. I'll simply leave that, and that I think that people can judge that on their own. But I think that WHO has also been accused of being slow, you know, for example, in declaring the pandemic too slowly, or being too slow in endorsing issues such as mask use. You know, most recently there has been a letter written to WHO saying that the virus, the SARS coronavirus 2, is airborne transmitted, and WHO is not leading on this. So I think that in certain respects, it's simply true to say WHO is slow. You know, it is not purely a technical organization. It is very much a diplomatic organization. It is very much has a very political role to play. And oftentimes, I think it is fair to say it is slow. But that I also don't think is it doesn't detract from its importance and the role. In terms of other things, such as technical advice, you know, should masks be used? Again, it is slow sometimes, but I think also because it is not an academic institution. What it says matters a lot to poor countries. If it says that countries should do something, it really puts a pressure on countries to do that. And so if you're an academician and you say that it is airborne transmitted and this is the truth, I think that is fine. And I think it is likely to be very much airborne transmitted to a certain extent. That's not the issue for WHO. The issue for WHO is what can it advise countries to do given the scientific advice out there. So I think it's important for people to understand these kinds of roles. So the bottom line is that I think that WHO can legitimately be criticized for many aspects of its importance. None of that, however, in my perspective, detracts from its utter importance. It is simply the hub of how we approach global health security. It is an essential function. It is an essential organization. It has a tremendous number of pressures and responsibilities to bear. And so the fact that it doesn't do well on all of them, again, I don't think really detracts from its importance. So,
Mike, I would just like to hear you respond to this from the US perspective. You know, you said a few moments ago that one of the startling things about this pandemic is that unlike past international crises, the United States is essentially absent. Where we were once leaders, we now are having to be dragged to the table. And of course, the Trump administration has declared that it is withdrawing from the WHO. So what does this mean for the WHO, and what does it mean for how the world organizes leadership of a crisis without the US at the table?
It's bad all the way around. Oh, sorry, Mike.
Mike's turn.
Go ahead, KJ, if you want to.
Mike's turn.
Now I'm all weed up about this question and stuff, but no, I'm sorry.
Well, I think first of all, let's not make any conclusions yet. There surely is a possibility that we will not withdraw from the WHO, which won't happen until next summer. We'll have to wait and see what the American people decide about that. But let me take a step back, and you know, I do this at great risk since KG is here and having been in the leadership of WHO and knowing the organization as well as anyone could. I don't think WHO is set up as a modern 21st century agency in the way that it could and should have been, because we're dealing with legacy issues that are really post-World War II. You know, when the regional offices were set up at WHO, and the United States had a lot to do with that, they put a tremendous amount of responsibility, authority, and decision-making in the regional offices. And part of that had to do with PAHO, having been an already existing organization, and someone didn't want it to be subservient to the mothership in Geneva somehow. And I think that if you're in leadership at WHO in Geneva today, you're always dealing with the difference in priorities and authorities between the WHO central office and the regional offices. And the regional offices oftentimes can take a very parochial view of things, just by the very nature of what KG just very nicely outlined was the working relationship and the diplomacy issues and how that basically unfolds. What you need is a public health agency that, while it has to have that diplomacy connection, has to be able to act quickly with scientific accuracy and make hard decisions that sometimes will not flow in the best ways with diplomacy, but they have to be the science. And I think that that's where I worry that among many of my colleagues, I have seen a ever increasing concern on their part that WHO has become obsolete. And that's from colleagues. And part of that is because of what has been perceived as being a slow uptake on science. A good example, you talk about airborne transmission, you know, the influenza world wrote off WHO some time ago in terms of transmission issues, because I think the data has been clear and compelling. So it's hard sometimes to support an agency when you have a difference of scientific opinion, for lack of a better term. And I think that happened. You know, I have to say, I was extremely disappointed in the time it took WHO to declare this a pandemic, realizing that there's an outside group of individuals that also play a role in making these decisions. You know, our center put out a piece on January 20th, laying out all the reasons why this would be a pandemic and what we need to do to get ready for it. You know, the day that we decided on January 20th and laid out the reasons why, I went to the 3M company here in the Twin Cities of Minneapolis, St. Paul, the largest manufacturer of N95 respirators in the world. And at that point laid out for them what was happening. The next morning, they put every machine they had in North America on full 24/7 production and made millions and millions of N95 respirators weeks before WHO ever declared a pandemic. Now, you can argue that you can say one of the reasons why they delayed on that, but it held us back from preparedness because people wanted to hear that decisive conclusion that we needed to do this. And so you can make an argument either way, that on one hand, it was, we didn't have the data, on the other hand, you know, it was very clear and compelling. So I worry that WHO has lost its edge. It's lost a competitive edge, you might say, for the scientific voice, meaning others have now taken it over. And the United States was part of that. Now I don't even know we can say that here is the case. So what I said earlier is what I was referring to is what was going to be post-World War II like, what in this case, what's post-COVID, post, you know, the current administration in the United States, what will public health look like? I don't think this is a time to band-aid WHO. I think it's a time to support WHO very much, but to build it in a new way. You know, this is no longer just about putting new screens on your windows. This is a total remodel of the house. And I think that it's really a time when, as we get through this, we have to look at that. We need WHO. The world needs an air traffic control tower that's informed, that is capable of incredible communication potential, and that can work very well in chaos. And I don't think we have the right air traffic control tower right now. And I think that would help a lot if we could reorganize it in that way. Something that people all talked about after Ebola and never happened.
Is there anything you want to say to any of that, KG, before I pop another question in here?
Yeah, let me just augment what Mike said and maybe twist it a little bit. But I think that I would agree with Mike 100% that WHO is not optimally set up as an agency for action. You know, so for example, the example which Mike gave between the regional offices and headquarters is true. You know, the leadership in the regional offices are elected independently of the leadership in Geneva, and so the relationship between regional offices and headquarters is not necessarily straightforward. But here is where I would make some distinctions. If we think that the value of WHO is as a directing agency, then I don't have any really fundamental disagreements with Mike, that it would need a certain kind of overhaul. My difference, though, is that I think the fundamental value and what makes WHO unique is its relationship with countries. And to give you a very direct example, I was in a developing country for a meeting, and someone from that country came up to me and they said, KG, we have been advised by CDC to do blah, blah, blah. And what does WHO think? And basically what they said is, we respect CDC, we trust WHO. That was a fundamental lesson for me in terms of global politics, global uniqueness, and what's needed in the world. And as I have often thought about that comment to me, because as you know, I work both at CDC and both WHO, and I could not have more respect for either organization. You know, I still have many friends and colleagues in there, but they're quite different organizations and they have different roles. If I think of some of the seminal things which have been done in the world, such as the eradication of smallpox, the effort right now to try to eradicate polio, for example, much of the heavy lift is done by countries. It is not done by WHO. And it is, however, bound together by trust in WHO. And that trust is really unique and very much at the heart of why you can do things globally. So while I do genuinely agree with Mike that in many respects, its performance could be strengthened and there are certain things which could be done, I do also have a very clear view on what I think is the importance of the organization and where the heart of that comes from. And I do believe that it is the relationship with each and every country and the level of trust which is invested in that organization, which allows it to cajole, to convene, to coordinate in a way that nobody else can do that. And somehow maintaining that is, for me, critical going forward into the future, because I don't see anyone else being able to step into that role remotely.
I want to redirect us from the transnational point of view back to the national point of view. It is really striking how many questions we have gotten from our, let me just point out, 103 participants around the world. And I'm sure many more will watch this on replay since it is kind of late here in the Eastern United States. How many people have asked to what degree sort of national character is playing a role in COVID response? I'm seeing lots of mentions in the questions of the hyper-individualism of the United States and to a lesser degree of Europe, of Confucian values on the Pacific Rim, stressing the communitarian good versus individual good. Is there anything to this idea of national character playing a role in COVID response? And if we agree that it is that deterministic in a way, that because the United States cannot reproduce the Confucian values of the Pacific Rim, it is therefore doomed?
Well, let me just say, I surely don't pretend to be an expert in political science and foreign affairs as such. Although I have to say, as a member of the Council of Foreign Relations, I have access to a number of the seminars, webinars, which I actually find very interesting and enjoyable. And I think the theme that I have heard over and over again from career diplomats, from people who really have expertise in this area, is that we are at a time worldwide that we've not seen since before World War II. And the sense of nationalism as it's been displayed by a number of countries, the authoritarian regimes that are becoming more prevalent, that democracy is actually on a slide, not on a stone up, has been very concerning. And so that, in a sense, what's happening with this response, it's overlaid on that. It's intricately linked to that because, in fact, that's leadership. And I think KG did a very nice job earlier in this program laying out the importance of leadership. So in many ways, I think if we had lived back even a decade ago or 2 decades ago, we would be seeing a very different response right now. And I'm not even talking necessarily about which person is president, although I think that surely has a major determining factor, but it's what were the whole world conditions. remember what it was like in the 10 to 20 years after the Berlin Wall fell. And now look what's happening in many of these same countries there. And I think that if you look at even Asia, you can see that same kind of nationalism is changing. And so, I think public health is not going to ever be devoid of that kind of relationship, and nor should it be. But what we have to do is do our job differently then, because what we have to do is still just as important. The viruses could give a damn who's in charge of the country. They don't care, and what we have to understand is how do we adapt what we have for public health. I mean, just the fact that we have this division in the United States on masks that has become so associated with one political party or another. I mean, who would ever thought that a major public health initiative or effort would be relegated to a debate about are you for or against the president? And so I think that's symptomatic of the times we live in. I would never have imagined that 20 years ago in my career that would happen like that. So I think that's where we have to understand whatever happens to the world over the next course of the next 5 to 10 years will have a lot to do with what people will accept or won't accept for public health.
KG, speaking from within Asia, what do you think about this question of the degree to which national character plays a role in success in the COVID response?
Well, I think there are two main aspects to this, and Mike has touched upon, raised the first one that I want to focus on first, which is the rise of isolationism and nationalism among countries and so on. I mean, clearly we are in an era in which, and we're in an outbreak in which national responses are visible, multilateral responses are almost invisible. We don't see that. But this is not isolated to COVID. We are seeing this in many facets. We are seeing the breakdown of a number of trade agreements. We're seeing the US walk away from the Paris climate accords and so on. And so this is broader than the COVID situation, but COVID is both exacerbating and landing in the middle of it. And again, it's a long discussion why this is going on, but I think it's hard to get away from the realization why we keep going back to look at the pre-World War II period with much concern is because, again, the resentment in countries about being left behind, the resentment among groups of people about being left behind, this being used to foster fragmentation and being used to foster populism and isolationism to a certain extent is very visible, very visible, and something we should all be worried about, because I think collectively how we counter that is going to be one of the great post-COVID challenges. The second aspect of it, though, is that, yes, coming to Asia, I think that there clearly is a difference in national characters and so on. You were mentioning things like Confucianism and so on. And earlier when I was talking, I said that there was a different balance here between the individual priorities and individual concerns versus a broader collective set of priorities and broader concerns. And everywhere you go, everybody has both. Everyone is worried about themselves, about their families, and so on. But also everybody has concerns about their country, about their community, about larger things. But where that balance lies is different among different countries. And again, one of the things which I'm struck by is that in a place like the United States, there have been episodes and periods in which the country has clearly been able to pull together as a country. Despite all of the fights, it's been able to pull itself together as a country. Now we have a political philosophy which may emphasize that party is more important than country. Now we have a lot of examples of where people are translating taking actions against COVID into something else, whether they're constitutional rights or whether they're individual freedoms and so on, and then almost fighting back on that. So mask wearing has become a political issue in the US, and it's a little bit hard to see that, but it is being seen that way by many people. And in Asia, you don't see that. In Asia, whatever differences in Hong Kong, for example, people may have with the government, they see that wearing masks, actually implementing social distancing is what is going to eventually bring the outbreak under control. They're worried about how Hong Kong in general is doing, as well as themselves are doing. And these are national differences or societal differences, and I think that they are real. And I think that they do have an impact on how we respond to something like COVID.
So I want to press a little harder on this question of the role of the individual. However, to whatever degree the role of the individual rises above or below the communitarian impulse in different countries. As Mike referenced, and you as well, KG, the individual rights have come so much to the fore in the United States, to the point that something as simple as wearing a mask, which seems like such a simple act, has become so politicized to the point that there have been murders over mask wearing. What I want to ask, though, is, given that we can see that individual action is playing such a role here, what are your thoughts, especially as we move forward into the next months, on what sort of messaging is going to work to convince people to act in favor of public health, in favor of the community? How do we, to borrow a phrase from the days of HIV, how do we implement harm reduction in a crisis like this? And what are the things we need to be saying that get the seriousness of this moment across?
Well, let me just, I think that answer that kind of in two ways. First of all, I've been saying for some time, in the end, there won't be blue-colored and red-colored states in this country. There'll be COVID-colored states. And, you know, I give you the example of if you and I are driving down the freeway and we're going a little too fast, and we're late though, and it's important we get there on time, and we come upon the scene of an accident where they're extricating somebody from the vehicle, and your heart goes pitter-patter, and you go, oh, I'm going to slow down, this is crazy. And for the next 2 days, I do, and then I'm right back at it. I think a lot of people right now feel like that's what's happened. They don't know people who have had COVID infections. They don't know anybody who has died yet. And they're really upset about what they feel has been a major disruption in their life. Now, juxtapose that to the 2 a.m. call you get when you found out that one of your loved ones was just killed by a drunk driver. And you make that a cause for the rest of your life. It never changes, it never stops. And I think as we see, unfortunately, as we see more deaths, as we see case numbers increasing substantially, we see more areas of the country now getting hit hard. I think you're going to see people changing their views of what this is all about, but it's so unfortunate it takes that to get there. And, you know, and the problem is it doesn't really get to be at its best in terms of influencing people till it's at its worst in what it's doing to people. And so I think that by the end of this, we will have more agreement about what could have and should have been done at the beginning. But I'm afraid it's going to take that, you know, kind of hammer over the head before a lot of people will understand that.
Yeah, KG, you're sitting in a more fortunate country. Do you have any thoughts about this?
Yeah, Maren, I think part of it is the message, but a great deal of it is the messenger. And this is why leadership is so important. When I went to West Africa several times for Ebola, and one of the things that was done on a very concrete level was to find community leaders. So these may be people running churches, these may be community elderly, sometimes there were heads of youth groups and so on, because it was clear that it was not so much what was said, but who was saying it. Because again, it comes back to trust. Who do you trust? Who do you listen to? And so I think that in the US right now, what is so, you know, visible is the lack of trust. And so no matter what one side says, the other side cannot hear it, or it cannot act upon it, or cannot accept it. And so I see that part of the rebuilding and part of the responding to COVID is going to require leadership. You know, it's partly the top leadership, but it's at the community level, it's at the state level, it's at the city level. and really for there to be some kind of consistency in messaging and the consistency in calling upon people to do things which are going to be good for them, but also good for others and so on. But I don't fundamentally see the problem as one of messaging anymore. I do fundamentally see it as a fragmented leadership, and as the messengers are giving so many different kinds of stories on both sides or messages on both sides. And so that's where I would focus a lot of the attention and sort of rebuilding the kind of group effort needed.
The degree to which so much of this is tied up in a lack of trust of other nations, of transnational organizations, of sort of self-concept as a country or as a political party or as a state is really fascinating to me. So thank you for voicing that.
Can I just add
yes,
one piece?
Please, Mike,
I think one thing it also adds is a lack of trust in science.
Yeah.
You know, we live in an anti-science world today where it doesn't matter whether it's climate change, vaccines. I can go through a laundry list of all the things that, you know, we couldn't be further away. I mean, we're already seeing the major movement in this country already advocating against taking a COVID vaccine because of, you know, the issue it's not safe, without any data at all to support that yet. So I think that the science trust is huge. That used to be the white coat of the world that would allow people to have the trust when they walked in the room. That doesn't happen anymore in many cases.
I think that's so important. Thank you. And, you know, we could spend an entire extra webinar on the role of public conversation and social media. When I look back at the outbreaks that all of us have been involved in, I realized that, you know, in 1997 in Hong Kong, people were mostly still talking on email and bulletin boards and mostly in sort of walled gardens like AOL and CompuServe. And in 2009, in H1N1, Facebook and Twitter were each only about a year or two old, maybe 3 years in one case. And now here we are with the world connected on WeChat and WhatsApp and Twitter, and it seems as much to our detriment as to have lost the promise of the internet, of this flattening of global conversation with this sort of inimical force that is working against public health is really difficult. And as I said, we could spend the rest of the night talking about that. But we're not going to, because I have just one question each to ask each of you, and this will be my final question. One of the questioners in the audience has pointed out to me that tomorrow is the 6-month anniversary of the WHO declaring COVID-19 as a public health emergency of international concern. And Mike, you have several times referenced what you've used the phrase the post-COVID world. So what I'd like each of you to reflect on for us as we sort of wrap this up is put yourself out a couple of months, 6 months, a year to whatever the hoped for end of this is, or wherever it is in time. How should we look back on where we are now, and what ought to be the enduring lessons that we take away from this global experience? I'll let the two of you decide who should go first.
I'll defer to my respected elder here.
Ooh. KG, I think you were nominated. I'm sorry.
Well, I think that COVID has really so starkly highlighted where we are vulnerable. Again, some of those things are hard to change. You know, I think leadership we started out talking with, but that is the leadership that you have at the moment. And so I'll simply put that aside. It's an important thing. But there are other aspects which we can change, and we should focus upon those because we can change them. For example, the fragmented approach to COVID in many different places simply reflects the fact that we have fragmented systems. In the US, one of the outstanding features of the country is that the healthcare system is fragmented. And so, you know, when you come to a place like Hong Kong, where it is very close to a universal healthcare system, issues such as who is going to pay for care did not come up as an issue. If we look at the problem of masks, there was a shortage of masks, or at least a concern about shortage of masks in the city for quite a while. And so stores ran out of them. But the effort was both to look at how Hong Kong as a group or as an entity could obtain masks. The discussions went into the production of masks in Hong Kong. It really became a very constructive discussion, and it's because all of the systems were working. The political systems were working. The private sector was brought into some of those discussions about how to combine and work on these things together. And if there's one thing which COVID has shown is that we are fragmented in terms of the systems that we have in many places. We are fragmented in terms of the national and global alliances that we need to deal with these future challenges which are going to come up. All of these things are addressable, and we don't need to approach it as it would be good to do that. We can approach it as that this is essential for you to not go through another event where the economic and the day-to-day impact is so huge. We should draw upon that. This is not do-goodism. This is really drawing upon that. You need this for your own survival. You need this to make sure that you don't go through this kind of hardship again. This is real politics, but it works. And it's important that we capitalize upon that kind of perspective to identify where we can reduce the fragmentation, where we can strengthen in a realistic way. And I think that is going to be issue number one. It solves what we've tried to do in terms of pandemic preparedness. It's just that I think that we have focused too much on the technical aspects, not focused enough on the political, systems building, bureaucratic, financial, legislative aspects of what is really needed to be in a better position. This is what I hope we learn. This is what I hope we do as soon as we have time to collect our breaths.
Thank you for that. Mike, the lessons we take into the post-COVID world, what do you think?
Yeah, well, first of all, thank you, KG. I think you did a really remarkable job of laying that out. Let me say, I think there are two areas that we really haven't hit upon tonight that play key roles in this. One is journalism. If I could ever say that I think that one of the really most important functions of this post-COVID world will be documenting what's happened, how it happened, why it happened, and what we needed to change it. And I think that journalism has become even more the critical record that we all need and use. I feel like, we're experiencing the public health 757 has just crashed. And it turns out that there were 427 black boxes on board, and we've got to go through every one of them. And if we miss any of them, we may miss the lessons. And I think journalism will play a role in that. I think the second area that we haven't mentioned tonight that is got to play a much more critical role is the private sector. They have suffered immensely, financially and otherwise, in this global world economy. And I don't think they ever thought they could be this vulnerable. I think they thought maybe a war could do it, another recession as such, but never an idea that a virus could do it. And I'm sensing that they have more interest now in being involved in helping to support that new world order of public health, to help support them. It's like an insurance policy. And so one of the ways that we haven't done all that well in public health is engage private sector in a much more fundamental way. And what's good for you is actually good for us. What's good for us is good for you. And so I hope that we engage that group in a much more active role over the course of the upcoming years, learning the lessons from COVID and what we could have done differently with their help to have done it differently.
Thank you both for sharing your thoughts about this very difficult moment in time with this global audience. We are so enriched by your wisdom and by the time you've taken. Dr. Keiji Fukuda of the University of Hong Kong, Dr. Michael Osterholm of the University of Minnesota, thank you so much. I'm going to hand moderation back now to Susan Kreifels of the East-West Center.
Thank you.
Thank you.
Okay, thank you so very much, to our speakers, Dr. Osterholm, Dr. Fukuda, and to Maren. We were honored to have so much expertise just packed into one program, and I know that our audience will go away with a much broader understanding of COVID-19. As Dr. Osterholm said, we're only in the third inning of this game, and that means I need to unmute. Sorry, folks. Yes, I want to thank again Dr. Osterholm, Dr. Fukuda, and Maren for being such marvelous speakers and a moderator. We had so much expertise packed into this program. We are grateful. I know that our audience will leave with a much better and broader understanding of COVID-19. And as Dr. Osterholm mentioned, we're only in the third inning of this game. So that means we still have a long battle ahead to defeat the pandemic. You also mentioned the importance of global response, and that really is the East-West Center's mission, not only in US and Asia Pacific, but around the world. It's about collaboration and cooperation. And Dr. Osterholm, I'm so glad you mentioned the role of media. I am hoping that the many journalists who are watching tonight or who will be watching on YouTube will take that message seriously. I know that you do. You've done, especially for those folks who are out in the front line reporting COVID. So thank you again to our speakers. We are so grateful to you. So grateful. Thank you. And now I will just mention briefly about our next programs in August for EWC Seminars Live. On August 13th, Thursday, we will look at democracy and the balance. Prominent journalists discuss how democracy in Israel, India, the US, and the Philippines is being eroded by contested elections, polarization, disinformation, and other challenges. And then on Tuesday, August 25, the program will focus on partisan warfare and voting in 2020 America. Hear from former presidential speechwriters as they discuss how the 2020 elections may reshape the Republican and Democratic parties and American democracy itself. We will be sending out announcements soon, and you can also check for information and registration and YouTube links at our webpage, www.eastwestcenter.org/EWC Seminars Live. Thank you again. I hope you will all join us in August. Aloha, and thank you to our speakers. Aloha.